All right, so for the next linkage which we'll be having, to heart failure is what is known as hypoxia. So we're looking at the link between hypoxia. Hypoxia is oxygen supply is not sufficient. Of course, oxygen supply, if it's not sufficient, it can affect any organ. Okay, but for us now, we are looking at heart issues in children, so we are just trying to relate this to heart failure, right? So first, we'll look at the introduction, then look at the various connections that hypoxia has with heart failure. So hypoxia is low oxygen levels in the body, can be a powerful trigger for heart failure in children, especially when it has been there for a very long time. So the heart and lungs work in tandem to deliver oxygen to tissues. So when oxygen is scarce, the heart faces a whole lot of pressure to compensate for this. All right. So what are the various linkages, right? So when oxygen levels drop, the body compensates by increasing how the heart is pumping. The body feels like if I increase the workload, okay, this issue will be solved. So this places extra strain on the heart, especially the right ventricle, which pumps blood to the lungs. So over time, it leads to ventricular hypertrophy and eventually failure sets in. Okay. Then next, pulmonary vasoconstriction. You can pause at this to actually observe. Okay. Pulmonary vasoconstriction. So hypoxia causes the pulmonary arteries to constrict. It's a protective mechanism to redirect blood to better ventilated lung areas. Okay. So chronic constipation leads to pulmonary hypertension. Chronic vasoconstriction, okay, leads to pulmonary hypertension. This increases pressure on the right side of the heart, because the right side of the heart deals with deoxygenated blood. It has to pump to the lungs. So there's a resistance. It has to do much work to overcome the resistance. So this results in pulmonary. It's a form of right-sided heart failure. So myocardial hypoxia, the heart muscles itself needs oxygen to keep functioning. Okay. So in hypoxic states, myocardium may not receive enough oxygen, leading to impaired contractility and low cardiac output. So on the systemic effect, it can affect multiple organs. It can trigger inflammatory responses and metabolic acidosis. So these systemic changes can further depress heart function and contribute to what? A lot of organ failure in the body. Okay, so that's it for the linkage between what? Hypoxia and heart failure in children.